After several delays, the Cornwall Regional Hospital in St. James is expected to be fully renovated by the end of the year. Health Minister Dr. Christopher Tufton gave an update while touring the facility last week. Cody Barrett reports.
4 more months to the end of 2022, and residents out west are hoping for the best with the renovation of the Cornwall Regional Hospital. The project is estimated to cost 5 billion Jamaican dollars.
The overwhelming bulk of that amount is being provided through grant funding by the Chinese government. The Jamaican government is providing some funding. This year, for example, we allocated $100 million as part of preparing the ground and doing a few other technical things.
In keeping with the Health Ministry's 10-year strategic vision, which seeks to build resilience in public health infrastructure, the Cornwall Regional Hospital will have new facilities in a number of areas.
The complex building of outpatient department, emergency department, lab, imaging department, surgery, intensive care, sterile area, wards consisting of some 220 beds, nurses' apartment building. It will accommodate housing for medical staff.
Dr. Tufton adds that it will represent the largest and most complex children and adolescent hospital in the Caribbean.
We currently do that with Cornwall, with the University Hospital and with Bustamante Hospital for children. Combined with this facility and the Bustamante Hospital for Children, it will provide significant added capacity, and it certainly will take some of the strain of the Bustamante Hospital for Children, even though that is up to 12 years old. This facility will be up to 18 years old to add the adolescent component.
He explains why the environment at Cornwall Regional will get more complex over the next year or two.
Because you not only have one construction site, which is the main building behind me. You now have 2, and they are significant construction sites. And you also have an active hospital compound. I don't think anywhere in the world, except probably a war zone, has this kind of scenario that has to play out and has to be managed over the next year to 2 years.
To minimize infrastructure challenges, the health minister says hospitals will have to improve maintenance programs. Cody Barrett for TVJ News.